What?
It's you in the background going, wow.
Hey guys, welcome back to our channel. I'm Qubekani and you're watching us clip here. So today I've got a video for you which I filmed a while back. It's a week that I filmed when I was doing my surgery replacement. I filmed most of it in Ipswich, but I think the first few minutes I did when I was in ADDENBROOKE'S hospital. So together the whole video just shows you what it's like to be on a surgery replacement. I hope you enjoy the video. So feel free to send us any questions in the comments or on social media and we'll get back to you as quickly as we can. Enjoy the video. So today I'm doing a first day of anesthetics. I start in a few minutes, but before I go I'm just refreshing on some basics, airway management, so that I look like I know what I'm talking about when I'm there. I'm in pretty much all day today and it's my first day, so hopefully I get to see some interesting things and learn a bit more about anesthetics. So today I'm doing my on-call surgery in the evening. I'm timetabled to be in from 7 p.m. to 1 a.m. I don't think I'll make it to 1 a.m. but I'm here and it's around 10 p.m. and I've just done a male catheterization. I'm really excited, so I'm going to get signed off by the nurse who supervised me, because we have to do a few clinical skills and get them signed off. I think that's been productive so far. I'll stay around with the on-call surgical F1s and go around with them, see some patients and hopefully practice taking histories and examinations, or just seeing surgical cases at night, and then I'll go home after. I'm not sure what time I'm going to leave, but I'm glad I've made it this far and I've got a clinical skill done, so I'm gonna head back now. I've just arrived in Ipswich. It is now 10 p.m. and oh my god, there were no trains between Ipswich and Bury, so that meant taking a train from Cambridge and then getting the bus to Ipswich. It's been the longest journey to Ipswich I've ever had. It usually takes about an hour and a half. It's 10 now, and I left Cambridge at 7:10 something. It's been a long journey, but I'm here and it's good. So I'm here to do the last 4 weeks of my surgery rotation. I did 2 weeks in Cambridge at ADDENBROOKE'S hospital and 4 weeks in Ipswich, and this is going to be my room for the next 4 weeks. Got a nice small bed there. So they don't give you very much in these rooms. Probably the most useful bit of this room, the sink and some fresh towels. So this is where I am. Quite a lot of flats. So I think I'm going to unpack and just sort out my timetable, put it in my phone, make sure I've got everything organized, because we have to do a few clinics and we have to get signed off on those clinics, get signed off on attending surgery and anaesthetics. Yeah, I'm so tired right now. The end of this placement signifies the end of year 4, so it's been good. Hopefully, I enjoy being in Ipswich. Ipswich is great, so I'm looking forward to this surgery rotation. I've essentially swapped with Jade because Jade is now doing an SSC and I was doing my SSC, so now we've swapped. I'm doing surgery, now she's doing her research. Okay, so once I'm sorted, I'll sort of make a video in the morning or something and catch you guys up on what I'm doing, my clinics, which surgeries I'm going to be doing, and the sort of things I'll be seeing and doing. Good morning. So today is my first day of surgery in Ipswich. This morning we have an induction at 9:30 and like an introductory thing after that, like introduction to surgery. And then at 1 p.m. I've got a clinical skills round, which is where one of us clinical skills tutors takes you around the hospital for like 3 hours, and they just try to get you signed off on your clinical skills. So like things like putting in cannulas, taking blood, doing blood cultures, doing ABGs, all that sort of stuff, I'm really looking forward to that because that means I can get signed off on the things that I haven't done so far. Hey guys, so I'm finished for the day, and just like a recap on what I've done today. We had the induction in the morning with a bit of teaching on orthopedics this morning, like an introduction. So he was mostly talking about, the lingo in orthopedics. So just knowing what the different terms mean. And this afternoon from 1 to 4, I was meant to go and do my clinical skills sort of round for 3 hours, doing different clinical skills and get signed off. But I realized I forgot my clinical version of this booklet. So we have a peer-to-peer one, which you get signed off by your friends, and you just go to the clinical skills room, you practice skills, you observe each other, and then you sign each other off. We have another one, which is meant to be signed off by clinicians and people working in the hospital, essentially. That's the one I forgot. Well, I think I forgot it at home. Chances are I probably lost it. I left it somewhere in the hospital, so I couldn't do that session. So then I decided to go to gynae theatre, which was really interesting. In year 4 in Cambridge, we don't get a lot of teaching sort of gynae stuff, but they asked us to go to theatre and do the clinics anyway. The theatre was very interesting. I saw sort of fibroid resections, and we also did a bit of anaesthetics, because in that time, sort of when the patient is being induced, and if you're with the surgery team, usually they're just sitting around and not doing very much. So as a student, to like maximize what you're doing with your time, it's better to just, even if you're not scheduled to be doing anaesthetics, it's better to just go with the anesthetist and learn a bit more about anesthetics, and then when the surgery starts, just move over to the surgery side and do it that way. That way you get two things signed off in one go, so which is good. So now that my day is finished, it's 5 p.m. now, so I'm probably gonna get some dinner. Look at a few emails, read a bit for tomorrow. Tomorrow I've got general surgery clinic at 8 a.m. So I need to read a bit up for that, so that I turn up and actually look like I know something. And then I need to actually start making a presentation for my SSC. I'm going to be presenting it on the 19th. So today's the 5th, on the 19th. So I've got about 2 weeks. That should be fine. But anyway, that's just a recap of what happened today and what I did. Oh, and when I did my anesthetics, like today, I also put a laryngeal mask in for the first time. Exciting stuff. So yeah, that's been my day. Good morning. Today I have a surgery clinic in a few minutes. I'm actually running a bit late. What time is it? It's 8:07. And I have a clinic, I think, at 8:30. It's a general surgery clinic. And I think the focus is on, I think the guy running the clinic specializes in colorectal stuff. So that's what I read up on last night. So I've got that clinic. Then after that, I have radiology teaching at 1. And after that, I have a sort of surgery overview lecture thing at 2:30. So that's my day. Good afternoon, guys. So I've just got back from clinic, and what time is it? I've got my watch on my belt. It's 12:30. It was a really interesting clinic. It was a colorectal clinic, and I saw quite a few interesting things. I mean, in a clinic like that, you see all your bread and butter sort of things like Crohn's, celiac disease, diverticular disease. So all the things you sort of read about, and it just helps consolidate it. So whenever you think about diverticular disease next time, you sort of picture a patient in their story, and it just sticks better. So now I'm gonna get some lunch, got some more coffee. Some meals I made when I came over, and yeah, I'm gonna get some lunch. Next I've got radiology teaching from 1. I'm not sure what the topic is. It's probably going to be about chest radiography, something along those lines. So yeah, I'm going to do that, and I'll probably read a bit for that, just as I'm having my lunch. But yeah, that's my day so far, and it carries on after radiology with a lecture on general surgery. I think they just tell us more about surgery in IPSWICH and how it's run and the things we can get involved in. But yeah. Good morning. So it is now the 3rd day of our placement in IPSWICH. And it's 10:50. So I've got a clinic this morning. These clinics usually start around 8:30, and people tend to leave around 12-ish to get some lunch. And today I don't have anything timetabled in the afternoon, so I'm going to try and go into a theatre and observe some surgery, and then get signed off on something else. So I don't know if you can see this. So that's what we need to get signed off on, like that list. And I've got signed off on 3 things so far in 2 days. I don't think it's too bad. So I'm going to get some breakfast and run off for my clinic. I think for a change today, I'm actually a bit ahead of time. So that's my plan for today. Yesterday I ended up going to bed around 12. It comes to a point where you just say, you know, I'm going to stop and go to bed. Otherwise, I'm not going to be able to get up in the morning. So that's what I did. Yeah. And also on this placement, we're assigned to a home ward. This is where you're meant to go in your free time, but there isn't a lot of free time, so a lot of people don't go as much or don't go at all. But my plan is to link up with a friend and go at some point and practice histories, taking histories from patients, doing a few examinations, and just watch each other and give each other feedback afterwards. We'll see if we can do that today. If we end up in theatre, it's probably not going to happen. But I'll keep you guys posted as to what happens today. So yeah, breakfast, clinic, theatre, and or visit our ward. I'm on orthopedics. First time on orthopedics, so quite excited. See you guys in a bit. So I'm just walking back to Pearson Road now for lunch. And that's the hospital there. And that is Pearson Road, just there. It's about a 5-minute walk. There's this big field between Pearson Road, the student accommodation, and the hospital. But yeah, I'm just going back for lunch now. And then I think I'm going to go into theatre. I need to find one of my friends and discuss the plan for later. But yeah, see you guys in a bit. So I'm in the IPSWICH doctor's mess now. IPSWICH hospital is probably one of the best doctor's mess. I'm just having a coffee, and they have like snacks in there, biscuits, and you can make toast. There's quite a bit of food. So I've just seen some hernia repair, and the surgeons are taking a break for an hour, and they're going back in to do a cholecystectomy. So I'm going back to see that. In the meantime, I'm just going to read up on it because I know I'll be getting questions on it. Good afternoon, everyone. So today is Thursday, the 8th of June. Oh, today's election day. So today's Thursday, the 8th of June, the election day. I voted a while ago. I did a postal vote, so all sorted. So today I didn't do a video in the morning because I woke up really late. This whole week is starting to take its toll now. Like all the early mornings, I really did feel really tired this morning. So I got up really late. I was late to the clinic. I was meant to go. But it was an interesting clinic. It was a general surgery clinic, lower GI. So a few patients there. So quite a few interesting cases. Got to use a rigid sigmoidoscopy. That was quite interesting. And I was there from 8:30 to 12:30. I stayed for the whole clinic. I came back here for lunch for just a few minutes, and then I ran back to theatres because I was trying to get my day surgery signed off. So what I found out was that in the day surgery suite in the hospital, there was a bit of TNO going on. So I decided to go into the TNO bit in day surgery. So I saw a few injections that they were doing in the foot. I think the patient had like arthritis in the foot, and they were injecting some steroids. So I got quizzed on the bones in the foot, and I could only remember one, the calcaneum, because it's the biggest one, and all the small ones I'd forgotten. So that was interesting, but they sent me off anyway. So after that, I ran into essentially the next theatre. The patient had like a hernia, and they were getting it repaired with a mesh. And I got quizzed on hernias again. I'd read up on hernias like a few days ago though, so it was fine. I knew some things for that one. It was much better than the TNO one when I was being asked about bones in the foot that I'd forgotten. In first year in Cambridge, you will know the whole anatomy. You will know everything. But then 4 years on, I mean, I remember things, but not as well as I did when I was in first year. Even when they were saying the names, I was like, oh, that's what it's called. But I guess like revisiting it a few years later, it's easier and you remember it easier, if that makes sense. Like it comes back a lot easier. It takes more effort to learn it the first time, and then every time you come across it afterwards, it's a lot easier, I think. But anyway, that was my day. So that took me pretty much all day until like 4, 5. Last night I ended up I got an email from my SSC supervisor. So I did my SSC, my research, just before I started surgery. And the research I did then, I wrote it up and everything, but they wanted me to present at a infectious diseases department meeting. So they sent me a reminder yesterday that, do you know you're presenting on the 19th of June? I was like, oh my god, I haven't even made the presentation yet. So last night I was just working on that. I've got a draft down, so after filming this I'm going to go back and polish it up, send my supervisor the draft so you can have a look and we can talk about it before I present it. But yeah, that's what I did last night. I went to bed around 11 p.m. I'm so glad the weekend is coming up. I feel really tired now. All the early mornings, they are taking their toll. It is like a draft that I made for the presentation, what I wanted to be in each bit and sort of the outline I wanted for it. So tomorrow I'm doing a breast clinic in the afternoon. I'm doing an ENT clinic in the morning, and I think we have teaching at some point in the afternoon. And then after that, I'm going back to Cambridge, going back to my flat, going back to see Jade. I think a lot of people would tend to go back for the weekend. If we didn't have teaching, I think a lot of people probably would have left this evening. But because of the teaching on Friday, a lot of people will stay for that. I think I've done alright in terms of getting things signed off. So this is where I am now after a week. So provided everything goes well tomorrow, I'm going to add 2 more ticks up here. All the theatre stuff, that's all done. I just have to do 2 on-calls, a few more clinics, and then I'm done. So it's been a good week. It's been a tiring week. I'll probably film just like a bit tomorrow. Hey guys, so I'm now back in Cambridge. It's Saturday morning. I arrived back here at 6 p.m. yesterday. I didn't do a video when I got back because I was out running errands. But yesterday when I was in Ipswich, I did do my breast clinic, which went really well because I got to see my own patients, which was very good. So I examined them and took their histories, and I also went to see some radiology. So it was good to follow a patient through from beginning to end. It was really good. And then after that, we were like running around trying to get a taxi and catch the train. So I didn't get the chance to film then. So I just thought I'd do this video to just round everything up. It's been a good week. It's been a tiring week, but I'm glad to be back in Cambridge. I'm chilling for a bit this morning, and then I'm going to go back to do some work because we have exams coming up. But yeah, I'm just glad to be home with Jade. Say hi.
Hi. Making notes.
But yeah, hopefully you enjoyed that video. So I'll be seeing you guys next time.